Lahey Hospital and Medical Center has an over 100-year history as a leading healthcare organization. Founded as a multi-specialty group practice, today we continue the tradition of the clinic model where we believe that patients receive the best care and have the best results when they are cared for by teams of doctors that share what they know. As part of the Beth Israel Lahey Health System, we are a nearly 400-bed academic medical center. We're certified as a Level 1 trauma center and a regional medical school campus for the UMass T.H. Chan School of Medicine, proudly serving patients across eastern Massachusetts and southern New Hampshire. We continue to host numerous residency and fellowship programs.
Lahey Psychiatry Residency program will provide you with a supportive and stimulating environment to learn. Our program empowers you with the skills to care for individuals with complex needs, lead interdisciplinary teams, and launch a successful career as a psychiatrist. Our program strengths include training in medical psychiatry and its subspecialties, our medical leadership curriculum, our expert faculty, many of them with teaching awards, and our rich and diverse training sites.
We do serve clinically diverse population in this area, and with multiple sites we offer, I think our residents will have a nice opportunity to have heterogeneous exposure to varied psychopathology. We are located in Eastern Mass, closer to the Boston area, with the proximity to nice beaches, several hiking trails with scenic views on mountains. The education system is great here. It's a place with outstanding cultural diversity, making it a really good place to raise your family. Overall, I think our program is going to offer a rich blend of opportunities for both personal and professional growth for our residents.
The outpatient department is comprised of a large team of psychiatrists, PhD psychologists, neuropsychology, social work, and advanced practitioners. We serve a diverse patient population with a variety of socioeconomic and cultural backgrounds, medical diagnoses, and full spectrum of psychiatric diagnoses. The longitudinal outpatient clinical experience, combined with supervision and didactics, will support residents as they develop into well-rounded psychiatrists.
One of the things that I think most attracted me to Lahey is the medical orientation of our psychiatry department. By virtue of its connection to a large teaching hospital, not only do we each care for a large percentage of medically complex outpatients, but the psychiatry consult service has a prominent role within the department. PGY2 residents will get exposure not only to bread and butter CL and emergency psychiatry, but also to important subspecialties within CL, including critical care CL, neuropsychiatry, transplant psychiatry for liver and kidney transplant patients, and addiction CL as part of a unique grant-funded program that is currently being developed within the department. I think it's an exciting time to be a learner in this department.
At the Community Behavioral Health Center, we have an ambulatory clinic servicing all age groups. We also have a mobile crisis service as well as a short-stay community stabilization inpatient unit. We are looking forward to welcome you to the full array of services we provide there.
At Danvers Treatment Center, we have an acute treatment service, which is the withdrawal management services, a clinical stabilization unit, which is a step down for patients who are completing their withdrawal management, and an outpatient opioid treatment program, which is known as the methadone clinic, and a buprenorphine outpatient clinic. So we hope to see you join us. Thank you.
Beverly, Bay Ridge, and Addison Gilbert hospitals are 3 specialized training sites in our psychiatric residency program. We're the Goldilocks of training programs, large enough to provide full scope of experiences while still being small enough to provide highly individualized training. You'll gain firsthand experience with acute and complex psychiatric disorders and diverse patient populations, and our trainees get to interact and contribute during all stages of the treatment process.
The subspecialty of neuromodulation in psychiatry focuses on a collection of treatment modalities that are largely biologically driven and meant to address difficult to treat conditions. Over the past 4 years, we've been able to grow the neuromodulation program here over 4,000 to 5,000%. This is a very unique space. It is the only freestanding neuromodulation center in the country for veterans. It provides state-of-the-art care as well as a comfortable non-medical environment. One of the aspects of this job that inspires me is the immense impact we can have on patients' lives. Sometimes going from treating someone in the ICU, literally on death's door, and then a number of weeks or months later, seeing them back to their normal life at work with their families. Something unique that we've been able to introduce over the past 4 years is a chiefship in neuromodulation. What a chiefship in neuromodulation affords is the opportunity to learn the modalities in great depth, go out and become leaders around the country in providing neuromodulation services and treatments. So in this critical field within psychiatry, folks leave with a toolbox of knowledge that almost no other training program is able to provide.
We are thrilled to be accepting our first class of residents from Lahey. We're a wonderful, vibrant community hospital with wraparound psychiatric services, including amazing emergency room, a 20-bed inpatient unit, and outpatient and partial programs.
So Cape Cod Hospital has a very large 80-bed to 100-bed emergency room, second busiest in the state of Massachusetts. We see all manner of psychopathology. It's a wonderful training experience to be able to see patients in the ER and to treat them. So we look forward to welcoming you to our team.
Thank you for your interest in Lahey Psychiatry Residency Program. We are excited to train the next generation of leaders in psychiatry, and we look forward to working with you.